Intertrigo is a term used to describe a rash in body folds or opposing skin surfaces such as the axilla, the groin, submammary regions, beneath an abdominal apron of fat, finger or toe web spaces. Affected skin is reddened and uncomfortable. Intertrigo is particularly common in those who are overweight and patients with diabetes mellitus. Body folds or flexures are prone to inflammatory rashes because of relatively high skin temperature and moisture from insensible water loss. Sweating that is not easy to evaporate, and also friction from movement of adjacent skin results in the sore skin. The causes are Candida albicans, as Monilia, tinea infection, eczema. It could be seborrheic, atopic, or contact, and psoriasis as flexural, and also erythrodermis. So the main symptoms are itchy, scaly rash, dry skin, weeping, reddened rash, and discharging lesions. The signs that are usually elicited are dry scaly skin, erythema, excoriations, papules, vesicles, creamy satellite pustules at the margins of affected area, persistent brown patches, well demarcated patches, and plaques or plaques. Investigations are patch testing for contact dermatitis, skin scraping for fungal elements, fasting blood glucose, swab for culture and sensitivity. The main treatment objectives are to relieve symptoms or associated discomfort, to identify and treat any predisposing factors. Non-pharmacological treatment: you wear loose cotton clothing and open footwear for aeration of folds. Also, weight loss. Avoid precipitating factors, if any. For Candida, Intertrigo, seborrheic eczema, or tinea infection, you use buconazole 2% plus 1% hydrocortisone cream topical. In adults, you apply 12 hourly for 14 days, and in children, you apply 12 hourly for 7 days, and then use buconazole 2% cream topical. You apply 12 to 12 hourly till rash resolves. In children too, you apply 12 to 24 hourly till rash resolves too. Also, you can give clotrimazole 1% cream topical in adults and children. You apply 12 to 24 hourly till rash resolves. Or you can use buconazole 2% powder topical in adults and children. You apply 12 to 24 hourly till rash resolves. Or clotrimazole 1% powder topical in adults and children, 12 to 24 hourly till rash resolves. You can give itraconazole oral in adults 200 milligrams daily for 7 days. In children more than 12 years, 200 milligrams daily for 7 days to 1 month to 12 years, 3 to 5 milligrams per kilogram daily for 7 days. The use of itraconazole is associated with potentially life-threatening liver toxicity, so you monitor liver function while on long-term therapy. For erythroderma, you use fusidic acid 2% cream topical. In adults, you apply 6 to 8 hourly to affected parts, and in children 6 to 8 hourly to affected parts. Or clarithromycin oral in adults 1 gram stat. In children 250 to 500 milligrams stat. Or erythromycin oral in adults 500 milligrams 12 hourly for 5 days. And in children 8 to 18 years, 250 to 500 milligrams, 12 hourly for 5 days. And 2 to 18 years, 250 milligrams of syrup, 12 hourly for 5 days. Or you can use Euconazole 2% topical in adults and children. You apply 12 to 24 hourly till rash resolves. Or Whitfield's ointment or Whitefield's ointment topical in adults and children, 12 hourly till rash resolves. For contact dermatitis, atopic eczema, or flexural psoriasis, use hydrocortisone cream 1% topical. In adults, 1 to 2.5% cream or ointment. You apply 2 to 3 times daily. In children, 1% cream. More than 10 years, you apply thinly 12 to 24 hourly in area of rash for 7 days. Or you can use mometazone lotion or ointment 0.1%. In adults, you apply thinly once daily for 7 days. In children, you apply thinly once daily for 7 days. Or you can also use betamethasone cream or ointment topical. In adults, 0.05 to 0.1%. You apply thinly 12 to 24 hourly for 7 days. In children, 0.05%. 1 to 18 years, you apply thinly 12 to 24 hourly for 7 days. Referral criteria: so you refer patients not responding to treatment to a dermatologist.